I'm so glad that the Surgery Center of Oklahoma came up in conversation, an opportunity to highlight them as what should be the model for the country. And Dr. Keith Smith is here. He is the medical director at the Surgery Center of Oklahoma. Dr. Smith, how are you, sir?
I'm good. Good morning.
Really good to talk to you. We first talked, I had to be 10 years ago. And I remember when we talked, I was so blown away, and I was so happy that you existed and that you opened the center. And I was just, man, I hope it works. I hope you guys thrive, and this is it. And here we are, and you're thriving, and it's awesome. And I hope it keeps going. You guys, the whole movement spreads. What are you guys? First of all, let's start. What is the Surgery Center of Oklahoma? And by the way, I want to say real quick, this is not an ad. This is not an ad source. This is the future of healthcare as it should look. So what is the Surgery Center of Oklahoma?
Well, thanks again for having me. The Surgery Center of Oklahoma is a free market loving, price displaying, physician owned outpatient surgery center in Oklahoma City with 130 surgeons now on staff. Multi-specialty, doing complicated pediatric surgery, joint replacements. We've been open since 1997, and our mission is simple: to provide the highest quality care possible at a price the patient will know prior to arrival, with no surprises. And I posted this website in 2009 with all of our all-inclusive prices. And Canadians were the first ones to arrive to take advantage of that, which should be a real warning for all the American people who think just tossing the keys to this industry to the government is a good idea.
How many different surgeries do you guys perform?
Since COVID, our volume of surgeries is down a little bit. We've ranged from 6,000 in 1 year to low during COVID of around 2,100. So we're bouncing back from that. It's a busy place.
How many different types of surgeries?
Probably 12 different types: general surgery, gynecology, urology, orthopedics. I won't be able to name them all. I mean, the website is surgerycenterok.com, and all of the all-inclusive prices are listed there.
Yeah, so I'm looking here. It looks like you guys have like 100 different surgeries, right? Because they each have different, like each category, like ear, you have like 30 different ear surgeries that you provide. So there's a ton of different surgeries. Okay, I want to talk specifically about the price, the transparent pricing. This is one of the wackiest things about healthcare, and it's a major problem. My wife went to the hospital the other day. She got a CAT scan, and I don't know how much it cost. And I'm going to get some bill in the mail in a couple months, and I don't know, will insurance pay it? I don't know if we were out of network, or who knows? It's insane. So, what is the problem with not knowing the price of your healthcare?
Well, not knowing the price up front causes a lot of problems. It allows a lot of shenanigans on the back end when people then figure out what can I get away with before they send the bill. The lack of visible pricing, though, prevents the creation of a functioning marketplace where I have to justify why a $4,000 knee arthroscopy that surgeon anesthesia facility at my facility is better than someone maybe across the street from me who decides to post their prices. And so the consumer, or the proxy consumer, the ombudsman for patient, their primary care doctor, they can help navigate patients to where they ought to be. But I think physicians can hardly claim to be financial or medical advocates of patients when they're basically an accessory to a financial crime, when many times walk out of a medical facility financially destroyed. So the lack of pricing displayed up front really prevents the creation of a functioning marketplace. And that's the problem. We don't have enough competition, and so quality then is therefore sporadic. This is not a market failure in the United States. This is an absence of the free market.
Yes. I want to get to that point in a second. Take a surgery that you guys perform. What does it cost versus the hospital down the street? What does it cost there, quote unquote?
Well, and we have to be real careful to distinguish between the terms cost and price. And the hospitals have taken advantage of that little nuance. They always want to talk about, how much it costs them to do a surgery. Well, the consumer doesn't care. I mean, the consumer, when they go buy a car, they don't care about how much it costs. They want to know what the price is. So, the price at our facility for a knee replacement is about $18,500. And that's surgeon, anesthesia, facility, home health visits for a week, all their durable medical equipment, 30 days of physical therapy, all their pain and anti-clotting meds. It's everything to ensure that it's cash out the door pricing. There are no surprises later. A knee replacement at a hospital, the prices are falling a little bit because the good news is, there is sort of a competitive market developing. But those prices at the big hospitals for the same service would range anywhere from $40,000 to $160,000, and it depends on the range where you are in the United States. If you're in the People's Republic of North Carolina, or Wisconsin, or Alaska, where there's no competition, thanks to the state legislators there. Then the prices are high. I mean, wherever you have monopoly or near monopoly, then the prices are just ridiculous.
So let's take your all-in $18,000 knee surgery, and compare it to the, let's say, $150,000 knee surgery. In the $150,000 scenario, who's getting paid in that system?
Well, paradoxically, the not-for-profit hospital. That's another term or phrase. People should really scratch their heads. Not-for-profit doesn't mean did not make a profit. Not-for-profit means don't pay tax. So not-for-profit hospitals poor mouth and have been poor mouthing, their situation since the late 1980s. But if you look around, you see them buying other hospitals. You see them buying physician practices. You see their billboards all over town. You see them advertising at professional sports franchise venues. So there's a real, I believe, successful propaganda movement in the American Hospital Association, and I think it is. I think it's very coached, because many times when you listen to a hospital administrator, he'll say exactly the same thing that someone else said. So the hospitals are making a ton of money. Now, not all of them. The rural hospitals are struggling, but they're struggling because the big mothership hospitals in the big cities are they're promoting regulations that only the big hospital systems can endure, and they know it is going to crush their smaller competitors, and then they can buy them for a reasonable price. So,
can you give me an example? Can you give me an example of a regulation like that?
Well, any regulation that requires a hospital, to provide, care by certified people, you have to have all these qualifications, or, now you have to buy this medical record system, and on it, you have to, betray all of this patient's private information. And, you have to have scribes, and you have to have all these people running around trying to comply with all of these regulations. And the giant hospital systems can endure that. The giant hospital systems are the ones who promote these regulations because they know the underdogs can't. And then, the next thing you know, you see the big hospital system owns every hospital in the rural parts of the state. And then people have less choice, prices go up, quality goes down. And that is not a market failure. That's an assist given by the real culprit in the industry, and that's the federal government.
We're talking with Dr. Keith Smith. He's the founder of the Surgery Center of Oklahoma. So I want to go back to the money here. So again, your knee surgery, $18,500. You say a knee surgery at a hospital is between $40,000 and $160,000. That's ridiculous. So again, people are having to pay their insurance, and I don't know where this money. Like, what is this money? Like, we have 4 kids, and every time my wife gives birth, we get like these ridiculous bills. It's like, what are these things? And like, who's paying? So give me an example of who else is making this money. You say the hospital is making money off this. What's up with what do we need to know about the insurance company and the prices that things are billed at?
Yeah, the insurance companies are making a lot of money after the gift that they were given in order to support Obamacare. They were granted this gift called this minimum loss ratio. What that means is 30%, no more than 30% of an insurance company's revenue can be used for administrative expenses. Well, once again, the giants could tolerate that, but the small insurance companies could not, year in, year out. So we went from having quite a few options to 4: Blue, United, Cigna, Aetna, Humana, sort of. Mm-hmm. So, this consolidation of the insurance industry, which was the purpose of Obamacare and was a huge gift to the giant insurance companies, made them rich. I mean, you can look at the stock prices for all these companies after Obamacare, and they've just soared. One thing people should know, though, is how insurance companies make money is sort of counterintuitive. They collect premiums and they pay claims and they keep the difference. But there's another little revenue generating tool most people are not aware of, and that is claims repricing. So, and that's a real problem with the industry. And and what we've done with transparent pricing is a threat. So if a hospital generates $100,000 bill and the insurance company rides in on their white horse and pays them $20,000, the hospital will claim that they lost $80,000 and use that red ink to maintain the fiction of their not-for-profit status. The insurance company will charge the employer group, to which that employee has employer-based insurance, and they will charge that employer group a commission for that $80,000 discount. Now, you think through that, the incentive is for the insurance company to seek out the highest prices they can find. The insurance company makes more money if they discount a $200,000 bill down to $20,000 than if they discount a $100,000 bill down to $20,000. So this claims repricing is a huge source of revenue for them because they get paid for these fictitious discounts.